Place the subject sitting with the feet on the floor to help stabilize the pelvis. A seat without a back support is preferred so that the rotation of the spine can occur freely. The cervical, thoracic, and lumbar spine are in 0 degrees of flexion, extension, and lateral flexion. Stabilize the pelvis to prevent rotation. Avoid flexion, extension, and lateral flexion of the spine. Center fulcrum of the goniometer over the center of the cranial aspect of the subject's head. Align proximal arm parallel to an imaginary line between the two prominent tubercles on the iliac crests. Align the distal arm with an imaginary line between the two acromial processes. Ask the subject to turn his or her body to one side as far as possible, keeping the trunk erect and feet flat on the floor. The end of the motion occurs when the examiner feels the pelvis start to rotate. At the end of rotation, one of the examiner's hands keeps the proximal goniometer arm aligned with the subject's iliac tubercles, while keeping the distal goniometer arm aligned with the subject's right acromion process. Place the subject standing with the cervical, thoracic, and lumbar spine in 0 degrees of lateral flexion and rotation. Stabilize the pelvis to prevent posterior tilting. Ask the subject to bend forward as far as possible while keeping the knee straight. Use a ruler to locate and place a first mark at the midline point on the sacrum that is level with the posterior superior iliac spines. Make a second mark 15 centimeters above the midline sacral mark. Align the tape measure between the superior and inferior marks. Ask the subject to bend forward as far as possible while keeping the knee straight. Maintain the tape measure against the subject's back during the motion, but allow the tape measure to unwind to accommodate the motion. At the end of flexion ROM, note the distance between the two marks. The ROM is the difference between 15 centimeters and length measured at the end of the motion. Place the first mark at the lumbosacral junction with a skin marking pencil. Place a second mark 10 centimeters above the first mark. Place a third mark 5 centimeters below the first mark at the lumbosacral junction. Align the tape measure between the most superior and the most inferior marks. Ask the subject to bend forward as far as possible while keeping the knees straight. Maintain the tape measure against the subject's back during the movement, and note the distance between the most superior and the most inferior marks at the end of the ROM. The ROM is the difference between 15 centimeters and the length measured at the end of the motion. Place the subject standing with the cervical, thoracic, and lumbar spine in 0 degrees of lateral flexion and rotation. Stabilize the pelvis to prevent posterior tilting. Ask the subject to extend the spine as far as possible. The end of the extension ROM occurs when the pelvis begins to tilt posteriorly. Hold a ruler between two posterior superior iliac spines and place a first mark on the midline point of the sacrum that is on a level with the PSIS. This will be over the spinous process of S2. A second mark should be made on the lumbar spine that is 15 centimeters above the first mark. Align the tape measure between the first and second marks on the spine and ask the subject to bend backward as far as possible. At the end of the ROM, note the distance between the superior and the inferior marks. The ROM is the difference between 15 centimeters and the length measured at the end of the motion. Use a skin marking pencil to place a first mark at the lumbosacral junction. Place a second mark 10 centimeters above the first mark. Place a third mark 5 centimeters below the first mark. Align the tape measure between the most superior and the most inferior marks. Ask the subject to put the hands on the buttocks and to bend backward as far as possible. Note the distance between the most superior and the most inferior marks at the end of the ROM, and subtract the final measurement from the initial 15 centimeters. The ROM is the difference between 15 centimeters and the length measured at the end of the motion.